This is the alcohol use pyramid. It describes alcohol use in the general population of adults in the United States. Approximately 70% of adults abstain from alcohol or drink at a level that is considered low risk. Only 4 to 5% of the population, or the tip of the pyramid, has an alcohol use disorder. 25% of the population, or the middle of the pyramid, drink above a moderate level, also known as risky drinking, but they do not have an alcohol use disorder. They are at risk for future problems related to alcohol, or they may already be experiencing problems related to alcohol, such as health, social, legal, or relationship problems. Screening and brief intervention for alcohol is most effective with this 25% of the population. From a public health perspective, the 25% of the population that drinks above a moderate level or has risky drinking but does not have an alcohol use disorder accounts for the majority of the harm associated with alcohol in our society. Alcohol screening and brief intervention, known as SBI, to decrease risky drinking, is one of the most effective preventive services for preventing death, injury, and disease, and it's also one of the most cost-effective services to deliver. Several national organizations recommend screening and brief intervention for alcohol as a routine prevention service in primary care. The evidence for the effectiveness of screening and brief intervention to decrease drug use is not as strong as the evidence for alcohol screening and brief intervention. Screening to identify marijuana, illicit or illegal drug use, and prescription drug misuse is still important in healthcare, but patients may require more intensive interventions in order to help them change. The evidence for screening and brief intervention to address drug and alcohol use in adolescents is growing. The American Academy of Pediatrics recommends screening and brief intervention in all adolescents.